Reactional sequencing protective equipment is a personal protective equipment in a speculative scenario in which design technology and machine learning are being deployed to tackle infectious diseases caused by various microorganisms and pathogens. The design and its surrounding frameworks focus on three major facets: protection and hygiene, transmission control, and medical research. The PPE device is equipped with independent inhale and exhale chambers, eliminating the potential of cross-contamination of the airflows within the enclosed respiratory area. Reactional sequencing sensors closely monitor both inhaled and exhaled microorganisms and pathogens after the filtration. A contactless readout is designed in the form of a bracelet to work together with the protective equipment. The PPE device communicates necessary respiratory data to provide the subject with the state of health and well-being, which can also be utilized under various contexts that will be introduced shortly. Inhaled airflow enters the device from above to minimizes droplets transmission while sampling airborne pathogens. Exhale venting suspends all its airflow until the inhale process is complete. Conversely, exhale chamber actively discharges all exhaled air from the enclosure, followed by a separated filtration and sequence sampling process before inhaling resumes. The closed filtration loop protects both the subject and the surrounding individuals from infection. The eye protection monitors hand hygiene during hand washing or at any occasion through projecting blacklight to visualize the remaining microorganisms on hand surfaces. Feedback image learning analyzes the projected image and updates the subject with a hygiene overview in real time. The transmission control utilization of the devices is focused on three settings: healthcare-associated infection (HAI), community transmission, and travel entry. The contactless readout in wearable bracelet is used to translate respiratory data from the PPE securely in the case of sharing under consent for transmission tracing and research purposes together with the PPE. Healthcare-associated infection (HAI) is the infection that a patient develops while receiving health care for another condition. The device proposes an effective and safe system against infectious disease transmission from person to person in a healthcare facility. While health personnel is wearing the set of devices, the reaction sequencing sensor actively detects and sorts the pathogens being inhaled. If an identical health-threatening pathogen is detected in multiple locations of the facility or being traced in the exhaled air, the personnel will be alerted and informed through the contactless readout. After reporting a possible transmission event, location marking, pathogen amount and concentration, and exposure time will be delivered to the HAI monitoring center. Through various models of machine learning, an early HAI mapping will be generated to visualize the current transmission state as well as its future trajectory. Subsequently, a containment protocol and treatment scheme will be modeled, prioritizing the protection of high-risk patients. Community transmission is more complex and variable than the case of HAI. The devices with a similar system can operate under a bigger context but requires more participation and alert from both the public and the authority to tackle in the event of transmission. The inhaled and exhaled pathogen are monitored in real time through the reactional sequencing sensor for any matching respiratory microorganism while may signal a symptom infection. The PPE actively filters both inhaling and exhaling air, protecting both the subject and the surrounding public. The subject can consent to report to disease control authority and alert community members. Sequencing, treatment, and vaccine research data is accumulated anonymously through the consented reports, which accelerates both containment and treatment response. Based on the location and condition marking of the detection, community transmission trend mapping will be modeled through machine learning models for real-time protocol and measure response. Active prioritized monitoring continuously updates the learning model of reactional sequencing sensor based on the current transmission state and the trajectory, prioritizing the detection and protection against the mutating pathogen. Prioritized monitoring mutually complements with transmission trajectory, reporting up-to-date data to disease control, as well as updating and safeguarding the public all under end-to-end consent. A global disease prevalence is highly probable given the complication of today's air travel. This model is proposed to secure border entry while retaining travelers' fast clearance and privacy. Contactless readout will be enabled as an entry passport in the scenario. The device will revisit past 48 hours respiratory pathogens and only send a yes or no signal to the border entry, allowing direct clearance or further medical attention procedure. The devices also enables medical research programs, prompting and connecting with new AI technologies in laboratories. During the laboratory research phase, various artificial intelligence and machine learning model can also be implemented to allow researchers capture key data of the pathogens and disease swiftly. AI-enhanced microscopy uses deep image learning and automatically extract pathogens and microorganisms, eliminating the need of traditional microscopy gram staining method. Under the research model, individuals can opt in the research program while using the set of devices. The extensive sample size and group allow the research phase to be far more accelerated and elaborated than traditional clinical sampling methods. In the event which reactional sequencing sensors need to be replaced or used for further research if an abnormal pathogen is detected, the replaced sensors containing microorganism samples and sequencing data can be acquired by the disease research laboratory. Large sample size with the assist of matching learning models can be crucial to the research of pathogen mutation and undiscovered strains, and thus maximizing the effectiveness of containment schemes and treatments.